my son Sean. You can take a look at him right now. He's just as healthy as can be.
She gets very excited about things like Blue's Clues and Dora the Explorer. It's just so energizing.
This is my son, Mark. His friends love him. He's always had a lot of friends, very giving. He loved to play with his Xbox, Nintendo.
Tori is, she's always ready when I come. They have this classroom set up for her, which is really nice. And she has come back to school now. And Monday was her first day, and it was like she never left.
All of our hopes and aspirations as parents are oftentimes for our children. You think your world is going to be a certain way once that baby comes, and then boom, you deliver a child and you have somebody in a white coat come and tell you there's a problem with your baby.
She just came out and said she's got Down syndrome, and I was deathly afraid of what was going to happen next.
Without Maryville, I probably would have a nervous breakdown by now. I needed their help, and I'm so glad they were here for me, and Mark.
The Maryville Children's Health Care Center was open to provide respite and transitional services for parents and children with complex medical needs.
All right, lady, let's go.
The center offers temporary relief and support by providing primary caregivers up to 14 days of respite services and up to 120 days of hospital-to-home transitional care for medically fragile children and their families.
Every year there are more and more medically fragile children. Every year technology is allowing us to save children that couldn't be saved before. And with that come a lot of training issues.
We receive trainings, as I said, from the companies for each individual piece of equipment because everything changes. Now, we in turn make sure that our families not only can handle the equipment, but that they feel comfortable caring for their child with the equipment.
When you have a baby with some special needs, you need a little instruction. They made sure I knew what I was doing, and so did she when we left. They made sure that any medicine that he was supposed to be taking was taken properly and showed us how to distribute it once we got him home.
The Children's Health Care Center is a very necessary part of the continuum of care for healthcare services. There are children who are ready to be released from a hospital setting. They're no longer acute. However, taking care of them in a home setting can provide some pretty severe challenges for families.
I still needed to work. I still have other children, and I was afraid I couldn't meet her needs, which as it turned out I couldn't.
I had Mark home for a year, okay, and he had nurses coming in, and it was becoming too overwhelming for me because I only had nurses 12 hours a day, and that was while I was working. And when I get off work, I was the nurse, and I was about to have a nervous breakdown. It was just too much for me.
We really look at the whole family. We're not just taking care of the medically fragile child.
The facility actually helped maintain the situation. I myself was in a medical situation, I have leukemia, and they were just as adamant about taking care of Abigail when she came to the facility, being a big sister, as they did Sean being a resident here for the short time that he was here.
We listen to the children, we listen to the parents, the primary caregivers. We hear their needs.
We have a program, a homebound program, when the children are out for any length of time. The teacher comes for an hour a day so that they won't fall behind on their schoolwork, or in Tori's case, so they won't regress or lose some of the skills they already have.
The same way they would be visiting that child if that child was at home, they can come visit the child here.
We're the family advocates, we're the educators, we're the caregivers, the supporters. These families, these children are not our patients. They're our extended family members. We're right there with them every step of the way.
Que aquí es un buen lugar. Llega uno a la casa y sabe que aquí está bien la niña. Y hasta ahorita está creciendo y se está viendo el cambio.
This is a very safe and secure setting that any family can feel comfortable bringing their child. We ask the parents to give us a list of who the children can visit with, so we know exactly who's approved to come in and out of the building when the family members aren't here. Every visitor that walks in the door signs in and signs out.
Being a newborn father and also watching my wife go through bone marrow, through chemotherapy, and my son in neonatal in the same hospital, I was really, really reluctant to give him up that fast to somebody who I didn't know, didn't trust, But after I came and toured the facilities and seeing really what this place was all about, I would highly suggest, if you're in need of their services truly, that this would be a caring and giving place to leave your children, honestly.
We have several bedrooms that can accommodate a parent bed in them. We also have a separate room down the hallway for families who they don't want to be too far away, but they don't yet want to leave. So they can go sleep in that room and let our staff take care of their child on the overnight shift while they get some sleep. Some families use us for respite care where they'll bring their child to us for a day, for a weekend, or for a week so that they can enjoy just a break from the day-to-day stress. Sometimes families feel a little bit guilty about that, and we tell them don't feel guilty because there are oftentimes, like I say, other children in the family. And there's a great benefit for those parents to be able to take a weekend trip away or just time to go to a movie or out to eat or just exist for a little bit of time, knowing that their child is in a very, very safe place.
Our nurses are going to treat these kids just like their own.
This kind of setting is a really warm and nurturing setting to recuperate in and get ready to go home. It's not a hospital. As you walk around and look at all the different bedrooms, each room has a different theme. They're decorated with a lot of passion and a lot of love from a lot of people who wanted to make a home-like setting that really wasn't a child's home.
So a lot of times you'll come in and there's toys all over the place, there's books all over the floor, and they're having the time of their life. And it's such a great feeling to know they're treating each other like they would in any other household.
Most of us are moms, and we think of the kids as children first. They're not the patients second. Yes, they need our care as far as nursing and stuff, but they also need nurturing. They need to meet their milestones or do what they can do as children. Our acuity levels are set up so that generally for every 3 clients we have one nurse and 1 staff member, which would be a certified nurse's assistant. That can change based on the individual client's needs. If we have somebody who maybe is highly technology dependent, a larger client, or someone that just has so much stuff going on, they may be the only client that nurse has that day, or they may just have 2 clients.
He gets great care here. They understand, they're very empathetic to my situation. And I've talked to a few of the staff members here, and they have actually walked in my shoes.
Well, I'm not just the administrator for this program, but I'm also the mom of a medically fragile child myself. I have an 8-year-old daughter that doesn't yet walk, talk, or chew. And so like many of the families that we service here at the Children's Healthcare Center, I live in a world of doctor's appointments and therapy appointments, so I could really relate to what they're experiencing.
When I would get stressed out, I'd be here, and one of the attendants or one of the aides and the nurses would say, "Yeah, it's going to be okay. You're going to make it. She's going to make it. Everybody's going to go back to normal." But you don't see it that way when it's happening, and it's so critical at the time that it's going on. But to have them here to tell you those things is really a big plus.
Nosotros le recomendaremos este lugar a las personas que estén escuchando, estén viendo.
It's not a big place, however, that's a good thing because your kids get that immediate attention. Mark gets that immediate attention, like one-on-one nursing, and that's what I really love about it.
There really is no other place like the Children's Healthcare Center.